The average psychiatrist these days gets no training in trauma. Zero. Certainly no training in brain development. All the stuff I said about relationships and childhood needs, they haven't got a clue about. What they see is somebody comes with a problem, you got a brain disease, let's give you a biological agent to balance your brain. So if you got depression, you must be lacking serotonin in your brain, let's give you a medication, SSRI, to increase your serotonin levels. You know how much proof there is for the serotonin theory of depression? How much scientific proof there is for it? This much. None, zero, zilch, nada, nothing. Which doesn't mean they can't help. But the theory that the depression is caused by lack of serotonin, there's no proof for it. And it's kind of like arguing, like, if you had social anxiety and you went to a party and you had a glass of whiskey and all of a sudden you became friendly and sociable, would that prove that your social anxiety is caused by a lack of whiskey in your brain, you know? It's kind of that kind of argument, you know? So they prescribe far too quickly and far too often and for far too long. Something like 25% of women in this country are on some kind of psychiatric medication. 25%. So if you're going to use them, here's the analogy that I give. Let's say somebody's stuck in the mud. Let's say there's a road here that you want to walk on. You want to walk on this road, but you're stuck in the mud right here. You lift one foot, the other one sinks deeper into the mud. Properly used, the psychiatric medication can get you on dry land. This is where you want to go. When you get on dry land, you're not there, but at least you can walk. Properly used psychiatric medications can do that. When somebody gets stabilized in psychiatric medications, that's when the work should begin. But the problem is that's when it ends in the hands of most physicians. No. Do they always work? No. Can they cause side effects? Yes. Can they make somebody a bit numb so that they can't deal with their issues? They can do that as well. But if that's the case, that's up to the prescriber to correct the thing, because you want the person to be able to deal with their issues and to feel their emotions. And sometimes with medications, that's kind of taken away. Well, that's just one of those side effects you don't want. But you can deal with that as long as you're aware of it. But as long as your only aim is to get rid of some symptom without looking at the causes, nothing ever happens.